These are the people who look after you when you're sick, when your mother can't, when you're lying in a hospital bed attached to a drip and a gentle hand pets you on the shoulder, letting you know that everything will be just fine. These wonderful people serve us effortlessly and make us feel as comfortable as possible in an otherwise uncomfortable situation. Yes, these are the men and women who walk the floors of hospitals across South Africa. These are our nurses. Manje, a nurse is a person who works with the sick and frail, ensuring that their road to recovery is quick and comfortable. They also make sure that the patients with incurable conditions are managed in such a way that any discomfort is minimized and that their health improves. Kumbulage ukuthi nurses are important contributors to the medical profession as they spend much more time with the patients than any other medical staff. These professionals work in three main fields, which are public and private hospitals and clinics, the army, and home care. These caregivers are on the front line of healthcare when it comes to being hospitalized, assisting doctors, and caring for patients. Let's find out a little more about nursing.
Akusibo kuphela bomake labakhetha bunesi. Futhi ke akusibo bonke bonesi labalandzela indlela lejwayelekile yokufundzela bonesi. Bonesi bemasotsha ke kudzala bakhona kusukela ngetikhasta Florence Nightingale, lo waba nguwe kuqala nesi lomsikati emhlabeni. Wakwadi kusebentela live lakhe nemmango wakhe abe afeza liphupho lakhe lokuba linesi. Ungakhona kufundzela bunesi ngaphasi kwemasotsha kulabafisa kuhola babe basafundzela. Bunesi baqala njengelubido lebe kungumsebenzi wawungenelwa bamvu labanesineke, ikakhulukati bomake. Kodwa ke njengoba umhlaba sewashintsha nje, nebamvu kanjalo bashintsha. Kanye-ke nako konke lokwenteka kulomsebenzi sekwashintsha. Bonesi ke abasafana nakuqala. Ekupheleni kwa-2011, iNingizimu Afrika yaba nokushoda kwabonesi labafika ku-46,000. Lokho ke kungashoda imbo letimbili. Kokuqala kuyohlala kunesidingo selusito lwakho, kwesibili tikhathi tiyashintsha, kanye-ke nemisebenzi longayikhetha kude ukwadi kusita labanye. Timbili ke tinhlobo tebunesi. Kunanesi lobhalisiwe nobe lofundzele lophinzwa abitwe nga-nursing sister, kanye-ke nalo sitwako lobitwa nga-staff nurse. Uma sewucedzile-ke kumele ubhalise ku-South African Nursing Council. Kodwa-ke akukhathalekile ukuthi ufundzele luphi luhlobo, lokudzingeka nje ukuthi ube ngumuntu lothandza umsebenzi wakhe, ube neluthando kanye nokubeketelela abantu labagulako. Kwenta-ke lokho-ke kuthuthukisa tindlela letinyenti ebunesini. Kufundzela lobuthuthukile-ke bunesi kutakusita ukuthi ukwadi kukhetha ukuthi ufuna kusebenta kuluphi luhlangothi, njengokusebenta kumbe ngebantfwana, kusebenta ngemathambo noma emamasela, noma kusebenta ngebantfu lasebakhulile. Kanti-ke sekubonakele futhi ukuthi kunesidingo lesikhulu kabi sabonesi basemakhaya, lapho khona nesi abhekeke ukuthi ahambe ayonesa leso sigulane ekhaya laso asinikete lolo lusito oludzingekako. Lolu hlobo lobunesi ke selukhule kakhulu futhi lushintshe indlela yebunesi eveni lethu labadzinga lusito kanye nalabanika lusito.
Alright, then the other equipment that you are going to need as a nurse in the community is going to have your bowmanometer, where you're going to measure the patient's blood pressure. You still remember how to use these things?
Indeed.
Great.
Wrap around
That's correct for taking the blood pressure. Also the pulse oximeter. These ones are very easy, where you just switch them on.
Nice and small.
Nice and small. The red little light is showing, so you put that on the patient's finger, and it will give the saturation and the pulse of the patient.
Mama njengoba izolo ngufonele ngisho ukuthi siza namhlanje suke vital A uzochecka wena, sichecke nomshini wakho ukuthi usebenza kanjani, and masiqeda ukuchecka umshini ngizochecka nawe blood pressure yakho, ngichecke ne-oxygen yakho ukuthi ingakanani emzimbeni wakho. And masuka lapho ke sengizokuchazela ke ukuthi umshini ufanele usebenzise ama-hours amangaki. Umshini awusebenza ama-hours ayi-5, 10, 15 minutes. Uma ungabe umuntu osebenzayo usho ukuthi usebenzisa ebusuku uma ungabe ulala, but uma ungabe ungasebenzi usho ukuthi-ke ungawusebenzisa emini nakhona. Uyakhetha isikhathi leso ubona ukuthi ungakhona ngaso ukuthi usebenzise nawo umshini, but kufanele-ke ama-hours angaba ama-hours angaba 15 to 18 hours ngelanga.
Ngiyathemba ukuthi now suyabona ukuthi without nurses the medical profession would be chaotic. These professionals spend so much time doing their job day and night, caring for our medical needs. Nursing can be quite a lucrative career. The average nurse can earn anything between 91,200 rands and 279,000 rands annually or per year. This can be broken down to between 7,600 rands and 23,250 rands per month, depending on the rank of the nurse and whether or not they are working in a public or private hospital. Working in a private hospital, a nurse can earn a higher salary. With nurses needed in the medical sector, there are a lot of opportunities. A nurse can find themselves working within the core hospital staff, working side by side with the doctors. They may also be dealing with the admin or general care of patients, whether it is in the wards or the operating theatre. They could be a private caretaker, a hospice nurse working with the frail, a military nurse, a registered nurse, a midwife, an intensive care nurse, or a theatre nurse. A nurse can also become an entrepreneur who is an independent care service provider. Manjege, there are many more opportunities for nursing jobs in South Africa, lana eMzansi, but let's find out what a day in the life of a nurse is like.
So manje ngisho ukuthi ngizoqala ngocheck umshini we-oxygen ya. Ngizosebenzisa insimbi yami encane. Oxygen yakho i-right, oxygen level yakho iphansanyana yona kancane. Kuyadingeka ukuthi uyisebenzise oxygen ngo 15 to 18 hours ngelanga. Angithi. So oxygen yakho ngizayithi kuma 75 of oxygen. So kwamanje into esizayenza zokufaka oxygen ukwenzela ukuthi ikhweze oxygen yakho ephezulu. Isizathu senza ukuthi ufake oxygen kungenxa ukuthi inhliziyo iyayidinga oxygen. Ingqondo ziyayidinga oxygen, umzimba nawo uyayidinga oxygen. Mongabe ukhathala uyabonisa ukuthi oxygen yakho emzimbeni iyehlile isizinga sayo. Oxygen enormal emzimbeni womuntu ifanele ibe sezingeni lesiko 90%. 90 kusiyaphezulu. Ungabona oxygen yakho isiba phansi kunalokho ngoba kawunawo umshini wokuzitesta, but uzizwe ukuthi uyakhathala. Nento ijwayele ukuthi uyenze ngazo zonke insuku ukuthi hayi ngizothi sengisenza lokho ngizakusenza lokho kuba nayo ukhathala i-oxygen level yakho iphansi. So kwamanje engizofaka ke i-oxygen sis, from there sengizochecka ke ilena i-blood pressure yakho. Uyabona inhliziyo yakho kuma 100 angithi pulse rate indlela eshaya ngakhona. So lokhu kuyabonisa ukuthi isilinganiso se-oxygen yakho emzimbeni sehlile. Yikho kwenza ukuthi inhliziyo yakho ikhanye kanye yathuthumela ngoba ayila oxygen enough. Ma ulokhu ufaka oxygen usebenzisa oxygen kakhulu, uzothola ukuthi inhliziyo la iyastabilize ishaye kahle ngesilinganiso esifaneleyo ya. Ma i-oxygen isehla isiyaphansi, inhliziyo isebenza kakhulu njalo ibhizi lokhu ya distributor igazi elingela oxygen enough. Lokhu kuya lead to i-heart failure ke.
Uqala ngapha leyo uzositshela ukuthi emzimbeni egazini lakho oxygen engakanani. Ukusho ukuthi kuzositshela futhi nenhliziyo yakho ukuthi ibitha ngakanani. Okuchaza ukuthi if inhliziyo yakho ibitha kakhulu futhi umzimba unala ushoda khona ngeoxygen, then kuya ngokuya mothola more oxygen inhliziyo iphinde igcine sehlishile ne bese oxygen egazini iphinde likhuphuke futhi. Lo mshini lokwazi usikhombisa lo. No i-right blood pressure yakho. Saseyinhliziyo ukushona cha nezinakekela nidla kahle futhi mama ngani
ya ngizama
exercise akona ngabe niyakwenza
la endlini
bandli ngiyabona thayi ngiyaklima impela la ekhaya ngiyathokozisa ukuhamba
nje uhamba sometimes ngaphandle nje.
Okay.
The life of a nurse seems like a very hectic one. You need to have a good medical knowledge as well as have the ability to be caring all at the same time. If nursing is something that you might be considering, then it is recommended that in high school you take maths, physical sciences and life sciences. These subjects will also assist you should you wish to further your studies. Manje, after school, a wannabe nurse can study nursing at a large number of institutions across South Africa. From universities and technicons to colleges and nursing schools, the options to study further are endless. You could get a bachelor's of nursing or a diploma from various institutions, including the SANDF, Medunsa, the University of Johannesburg, University of Pretoria, the Vaal University of Technology, DUT, University of Fort Hare, the University of Venda, Wits University, and many, many more. Segiyacaca ukuthi this is a very demanding career, and in order for you to make it in this sector, you need the qualification. Not only that, but you should also have the personality to go with it. A nurse needs a caring and compassionate personality, since you will be caring for anyone who is a patient. Nurses should also have empathy and patience, which is often tested in their line of work. Since you will be dealing with people, you must have appreciation for human life. It's really important that you are a strong person emotionally, as you may have to deal with losing patients that you have cared for. Manjage, the work environment for a nurse can differ, since they can work in so many different sectors. Kumbula-ke lapha ekhaya ukuthi ama-nurse that tend to work in a public or a private hospital will often be exposed to a very emotional and personal environment. Working as a nurse can sometimes be high-pressured and stressful, as you are dealing with people's lives. Late nights and early morning shifts are experienced very often, so you should be someone who is really dedicated to the job and does not mind working on weekends and even public holidays. The environment also requires you to follow very strict health and safety measures, as you are dealing with medication and the lives of other people. Manje, it's a well-known fact that nurses form the backbone of healthcare systems the world over. So if you think you've got what it takes, why not give it a shot?